On July 1st, our borders will reopen, welcoming the first visitors in over 3 months. Jitneys and taxis are back on the road, beaches and parks reopened, and school students sit national exams. It would seem as we are finally in the clear, but au contraire. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. It's been said COVID-19, not a government, decides what we do next. While our numbers continue to decline, just next door, the United States is battling a surge in cases. Tonight, we sit down with two of our best medical experts. Our topic, not out of the woods yet. Our discussion begins on the other side of this break. The project really pays itself.
Correct.
They set up
at the conference, more at the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
Welcome back. You're watching On the Record. I'm your host, Jerome Sawyer. Thanks for tuning in. June has been the best month so far as the cases of COVID-19 decline and the curve flattens. My guest for this portion of the show is the Deputy Chief Medical Officer, Dr. Delon Brennen. Delon, welcome back.
Thank you, sir. Thanks for having me.
We're in a different season, so to speak. As I said in the opening, this has been a really good month for us. The curve has flattened, our numbers have leveled off. And I want to begin by talking about those numbers. We've been able to maintain the same numbers pretty much for the past few days, with the only numbers changing, I think, for the most part, are those who are no longer active cases. Right. We've seen that number increase, which is a very good thing. Mm-hmm. What does this mean for us?
I think what we can take from this is that our initial response around COVID-19 in the Bahamas was a measured response, and it bore the fruit that we wanted it to. So what we wanted to do is make sure that we identify cases that were in country. Mm-hmm. We contact traced around those cases, and we were able to sustain the spread of the virus such that we were only ending up with clusters of cases rather than community spread where spontaneous cases are just popping up everywhere. Once you're able to contain around that, you contain the spread, and then you minimize any other movement and people becoming sick or becoming asymptomatic carriers or needing hospitalization. So that has been positive to say that what we did as a country, not just as the health side of things, but as a country, what we did has worked to date, and that we should continue to use similar practices to contain ourselves in country and the number of cases that we predict that we may have.
The number of the reduction in active cases has been steady,
yes,
almost daily. What do you attribute to that?
I think that is a continuous follow-up. It's really kudos to our contact tracing teams that go out every day. They have conversations they call them up on the phone, they visit our active cases, they have conversations with the contacts of those cases, and they make sure that those people have recovered fully from their disease. They're not just continuing to have symptoms. They make sure that they maintain themselves within their residences or the hospital, depending on where they're being quarantined or isolated. And we want to make sure that we keep a finger on the pulse of what's going on with our cases. And really, that has been the hard work of the nurses and physicians that are active on that team to make sure that we contain the disease.
From the very beginning, there were these widespread calls for more testing. We were even, hearing that, the numbers aren't high because we aren't testing enough. We still have relatively low test numbers, mm-hmm, but seemingly that has worked for us. Explain to us, even though we haven't tested a lot, we still seem to have a lot of low numbers.
Right. I think what you see is really a strategic approach to testing. It isn't that we think that mass testing is going to get anything that's going to reveal something that is going to change our approach. What we've seen in other jurisdictions where they do have large amounts of testing, that has not decreased their numbers, and it hasn't slowed their acceleration. We see it going on in our neighbor to the north. You see these skyrocketing numbers of infections and these skyrocketing numbers of people who are in their hospitals, in their ICUs, overwhelming their healthcare system. What we have done instead is, instead of placing all the emphasis on testing, making sure that we use our public health measures and public health approaches to contain the disease itself. So you test around noted cases. So if you detect a case, you test around that case. You then contact trace and make sure that those people are placed in isolation or in quarantine, and make sure that they're not moving about the community and able to spread. So you won't need to do mass testing if you can identify every single case and you keep them in a place where they're no longer able to spread it to someone else. And that's obviously not just here in the Bahamas, but if you see countries that have taken the approach to contact tracing that we have, even though, like especially in our region, those numbers may still be low when it comes to total number of tests, their number of infections are also low, the number of people who have needed to be hospitalized is low, the number of deaths is low. If you were saying, if the conspiracy was that we're not testing, so our numbers are still high, you would still see high numbers of individuals presenting to our healthcare institutions, our clinics, our hospitals. You would see a lot of sick people. There would be a lot of people in the ICU. There would be more deaths. And then you could say we're not doing enough testing or we're not doing enough work. But I think the converse is true. Our testing has followed an approach that has suppressed the amount of virus and disease going on in country.
Have we seen the worst yet?
It is very hard to tell. I think we've seen the worst of this phase of the outbreak. We know that for sure our numbers are lower. We were seeing higher numbers in April than we are seeing now. And May was a decline, June is a decline. So we know for sure that our approach to numbers of cases per day has definitely declined, and we've been able to suppress that. So I think we've seen the worst of what we have going on right now. What we do have to make sure that as we change and we have an opening up of our society, an opening up of our economy, and you got a lot more movement of persons within the country, but also to the country, that we continue to make sure that our public health measures are in place, because if we then let down our guard, we could see an even worse approach to the disease and an even worse set of numbers, as in numbers of cases, that could happen if we weren't to be as vigilant as we have been.
Naturally, as we've moved through the phases, people aren't as anxious. They've been able to do certain things. Your life in many ways is returning to normal. But psychologically, have we let down our guard as a people? Just in things that you've noticed and you've seen and things that have been reported, because obviously you all are monitoring, but right. Psychologically, have we let our guard down?
Yes, I think as a people, we have definitely let our guard down. What we saw is, especially as we first started opening up and we had some of the phases going on, you saw people who were very vigilant about making sure they hand wash, making sure they social distance, they paid attention to how far they were away in a line from someone else. They made sure that spacing was going on. They would wear their masks no matter where they went. As we have continued to open and more places open, you see less and less of that happening. And so people are willing to sit together, regardless of if there is a family if they're just family members, or if there are persons that they have no idea what their level of exposure could have been, where they've traveled, who they've come into contact with. We see people who are, not just socializing, but intentionally moving into some of these areas, whether it's food eateries, whether it's food stores, whether it's social atmosphere. People are just saying they're fatigued around Corona as a whole, and they need to make sure that we are not ignoring the numbers that are still going on out there. While we are fairly safe in country, we can see what will happen if we don't pay attention and we don't keep guarded to our situation.
As we have relaxed the measures in many ways, we see in some instances the healthcare system as well has relaxed certain things. And the question that I have is, is our healthcare system still as prepared as it was 3 months ago?
I think we're even more prepared now than we were 3 months ago. We still have the infrastructure in place. We have the supplies in place. We have the testing approach. We're actually advancing in our testing as well. So we are adding more testing supplies, more machines, and we're moving to, especially in the public health sector, to having testing available in multiple locations. So I think we are advancing our ability to take care of cases. What we do know is we don't expect that this has gone away from a healthcare perspective. What we know is we don't have community spread currently going on in country, so it makes no sense for us to continue the heightened level of approach where you don't have visitation in the hospital, where you don't have just normal activities, teaching and learning sessions, things of that sort that we eliminated. We know that we need to restart some of those things, but it's the approach to doing so. Does it all have to be in person? No. We can do some virtual learning platforms, we can do some virtual patient interactions, some virtual visitations, but we have to be prepared that if something were to occur, we were to start having an influx of new cases, that we could revert our system back to where it was, and we could have an enhancement in the number of facilities that could do it. So I would say our ability to take care of patients has grown. Right now we're in a lull that we're able to relax and allow people to de-stress a little bit, because if you didn't and you just ran, we experienced this. We were going from Hurricane Dorian and its issues into preparation for Ebola and the concerns around that in the end of December. And then January we jumped into COVID and our preparation for that. Our healthcare system has been churning at full steam for a long time. We need to at least have some period where people can sit back a little bit and get back into some sense of normalcy, because if things pick up again and you didn't allow that, you would see lots more burnout that could happen in our healthcare providers.
During the recent budget debate presentation in Parliament, the Prime Minister made a very interesting statement. He said, and I quote, "Just as in the nations of the world, the Bahamas must continue to balance health, economic and social concerns in order to ensure viability and sustainability of our countries." How do we do so without putting the health of our residents and citizens at risk?
I think exactly what he was saying was it's a balance, right? So let's not ignore what we've done from health. Let's not put it on the back burner. Let's not put it away altogether. Let's make sure that as we address our economic needs, and we can't function in the health system if there isn't supplies and paying people to do the work. So we understand the economy is important. We understand tourism is important as well. So all we're saying is make sure from a healthcare perspective we don't ignore the appropriate measures that need to be in place. So, when there was the changes that were being contemplated to our testing protocols when residents and, anyone visiting the country was coming in, we were strong advocates to say, while we absolutely understand, we have to be smart about how we do it. So we're not saying don't allow persons to come into country. We're saying when they do, let's at least minimize some of the risk by ensuring that we remain with the similar protocols to testing as we did before. And so that was something that was taken into account, and so it became a balance. Before, there was nobody coming into country, so there wasn't a balance at all. It was health had taken over essentially, and but now we realize we need to have that balance, so we're saying, sure, introduce tourism, introduce economic things, but make sure that you don't lose on the health side, because then it won't be balanced at all.
Good stuff. So stay with us when we come back, part 2 of our conversation with Dr. Brennen. You're watching On the Record. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
Watching On the Record, this segment is made possible by Executive Printers. According to the government, July 1st will mark the reopening of our borders to international visitors after some 3 months of inactivity. My guest tonight helps us to understand what this means for the public safety of Bahamians and those visitors alike. He's a Deputy Chief Medical Officer, Dr. Delon Brennen. What can we expect once the country reopens its borders?
I think there's an expectation that as we have visitors come from the outside, there's definitely the possibility of the reintroduction of COVID-19 into country. I don't think any of us believe that any measure you put in, as long as you allow persons to come in, is going to eliminate that risk. Can we find ways to minimize that risk? And so we slow the number of cases that come in? Yes. So I think maintaining our testing practices will help to do that. But of course, we know the testing is only a snapshot. So it only tells you for that very moment that that person's not infected. 2 days later, 3 days later, they could be not just infected, but they could be shedding virus at that moment. So they could travel and then they could come to the Bahamas and do so. The important thing is that we maintain our ability to contact trace around it. So when persons do come in, we have all of their information. We know the contact information for all the people that traveled on the same conveyance that they did, whether that was a boat or a plane. We know everyone so that we can get in contact with those people as well. And then we'd be able to find out from them, where did they go? Who did they come into contact with as best as they can remember, so that we can do appropriate contact tracing around that. So we expect that there will be cases. This is not an if it will happen, it will happen, but it's what our approach is going to be when we do so.
Now, when you consider the amount of contact tracing that it's going to take, that's going to, I guess, quadruple the workload. If you think about it, if you had a plane load or a boat load or whatever, then if you're in a hotel, are we able to, do we have the resources to be able to do that? Because you're talking about going from, you know, maybe looking at 15, 20, I don't know, however many people were around a particular case, now to a much greater number spread over who knows what space. But how do you begin, are we able to keep up with that now that that's going to mean even more work?
I think our approach in the healthcare sector has been, we expect that we are going to need additional resources to do so. So we've started reaching out to other parts of the healthcare system, but also thinking about using models that have been put in place in other jurisdictions as well to do it, not just using healthcare providers, right? So we're good at it, but we can also train other people to do so as well. So whether you're using, a health workforce that is in environmental health, whether you're using a health workforce that's in the tertiary care institution or tertiary educational institutions, so using like college students and the like, you can train them to become part of your healthcare workforce, especially those who are in nursing training programs or medical school training programs.
So it's not a highly specialized skill.
No, contact tracing is one of those things. We need you to be able to phone someone. We need you to be able to go out and visit people to make sure they're in place. We need you to be able to do this interview, find out specific questions about them, so that we can then, if we need high level specialized, it won't be everyone who needs it. We can dive into particular cases and do so.
Are private practices at that point that they're able to do COVID tests, or is everything still coming to the National Reference Lab?
It is a combination right now. So we have private sector facilities that are doing testing as well. Most of them are doing it in a way that they are sending it out to other reference labs outside the country. So they may be sending to the US or similar, where you can do the appropriate testing, the real-time PCR testing. So they're not doing it in-house, but there are some others that are trying to develop that capacity in-house to be able to do so. And we look forward to that as well, because we don't expect that we'll be able to use the National Reference Lab for everyone and anyone who's coming in. We need to use those resources for particular investigations.
If we're talking about using outside resources, how do we assure or reassure folks that we're getting the same level of testing? I mean, I know the National Reference Lab does an excellent job, and they've been pretty much on point throughout, but how do we ensure consistency in the testing?
What we ensure is that the labs that we will accept as true for reporting purposes in country are certified or accredited labs, even if they're outside of the country. So there are certifying boards or accreditation boards from different areas. So in a particular jurisdiction, if it's the US, if it's the UK, if it's the Caribbean, there are boards that will certify or accredit particular labs. So we use those boards to make sure that those particular labs are certified or accredited, and then we are willing to accept those. So people come to us all the time and they present lab results, and we tell them, we are able to research this lab and find that it is accredited, and if we are not, we will not accept those results. And so people are into that mindset now. You know, the casual visitor may not necessarily be attuned, but the healthcare providers in country know quite well what the certification requirements are, and they'll toe the line when it comes to that.
Is it that we know that the National Reference Lab is not able to handle all of those tests or the amount of tests?
Not necessarily. I think there's a choice that people make. They know what is happening in our National Reference Lab requires you to A, have symptoms, or for someone who's being contact traced around a case. So that comes through our communicable disease surveillance unit, the Ministry of Health, the Department of Public Health, and then we send samples to the National Reference Lab. So that's how they get their samples. But if someone just wants to show up and have testing done, you know, a visitor has shown up, or a resident has shown up and they haven't had appropriate testing, they don't want to go into quarantine for the full 14 days, well, that's something that you may have to arrange on the outside, because we can't use our resources for every time something like that happens.
Okay, makes a lot of sense. We remember initially the government was proposing to open the borders to tourists without having done a COVID test, only for them to recall that decision and say that, you know, incoming travelers must present a negative PCR test for COVID-19 taken within a 10-day window before traveling to the Bahamas. Is this move in the best interest of public safety? And I want to talk about the 10-day window and why is that significant?
For us, the testing is very important. It is one way we can help to mitigate the risk of persons coming in and being infected. Again, it does not eliminate it. I think we've talked a lot about sort of the incubation period around COVID-19 and what the science supports. So we know that most people, if they are going to have symptoms with COVID-19 from the day that they get exposed to the time that they will start experiencing symptoms or start shedding virus is about 14 days. So if you have no shedding of virus and you have no symptoms that have developed in that time, you're likely you're not going to shed any virus after that, because that's sort of the accepted norm. The issue comes about, and that's why we're saying testing needs to be done, and as close to the time they're going to travel as possible. So if the Ministry of Health had a perfect way to do this, and I think not just the ministry, but any jurisdiction would do so. They would say, if I could test you right before you got on the plane to make sure, or boat to make sure that you weren't infected, then I could say, right now you're not shedding virus, and I'd be able to help move this along and be very comfortable that the likelihood that you're going to shed virus for the time period you're in the Bahamas is small. However, since that type of testing ability when it comes to real-time PCR is not necessarily widely available, we have to have a period that would allow persons the time to be able to get the testing done. So when you look at what we've been receiving so far, most people are able to get tests, but sometimes those results don't come back for 3 to 5 days. So if I say you need to be tested within 2 days, well, they just won't get results at all, so they wouldn't be able to travel. So if you say, let's stretch that out to maybe 5 days. Sure, most people will be able to get their results by then, but what happens if you get an inconclusive result and you need to be retested? What happens if you get a result that is, they say it wasn't enough sample, or it was a weekend that was in the middle, so it stretched it out a little bit longer. What we wanted to do is give some sort of buffer that would allow persons time to be able to get those results. It is not the ideal. No one, using the science would say that the ideal time is 10 days. But it allows us to balance, testing and allowing people access to testing and getting their results in time to be able to make reservations and then come to the Bahamas without suppressing those issues, but not letting it run rampant and say we'll just not allow testing.
There's that balance you talked about earlier, balancing the economic considerations with the healthcare considerations. There are exceptions for Bahamians and residents who travel for 72 hours or less. You'll undergo screening by the Ministry of Health, and it's up to their discretion, and you are subject to being quarantined for 14 days. I want to talk about that 72-hour window that Bahamians and residents have. Why give us that 72 hours?
It's related to this testing and the ability to get results in time. So if someone were to travel let's say, and 24 hours later they're returning. There's no way you'd be able to get test results within that time period. It's just impossible. So 72 hours is about the time, so we said about 3 days would allow you to say, okay, we know it's unlikely for you to be able to get test results if you were there for 3 days. If you were there for 4 days, 5 days, it's likely you could get a test done and get the results back in time. And that's really why it's sort of that 72-hour cutoff was allowed. Again, is this the ideal? Absolutely not. Because what it also means is if you're only going for, let's say, 4 days, you're going for 96 hours as opposed to 72, the timing where you would have to get your test done in order to get your results, in order to return, you'd almost have to do it the day you got there or the next day.
Literally, you jump off the plane and get a test.
But that doesn't necessarily measure the amount of exposure you may have, and definitely doesn't give you enough time to then start shedding virus to be able to pick up as positive. Because the test today gives you a better idea for the last, let's say, 14 days or so and before. It doesn't tell you necessarily about a day, 2 days, 3 days before. So there is some unfortunate balance that you have to bring to this. We have to make sure that we're not just saying if you leave and you come back, you don't need to be tested because you're a non-resident. And that's why there has to be some discretion, and it's written and said the way it is, because it allows us to say, if we think that you have been to an area where there is high community transmission, even though you don't need to be tested to return, you may still need to go into quarantine because your risk is higher than someone who went to an area that doesn't have community transmission going on for a very short period of time, and you come back. You have to have some leeway to be able to protect the Bahamian people.
And again, I want to talk about, very quickly before we go, sort of that quarantine period and being at your discretion. Let's say I go for 3 days, but I don't need the test when I come back. Do you all determine that I go into quarantine? Is it automatic? How does it work?
No. So everyone who comes back, or everyone who is coming to the Bahamas, regardless of residency status, has to fill out a form that tells us that you're coming into country. What we do is we do a risk assessment based on what it is that you put on that form. So we look through that form and we say, okay, this is where you've been. This is what your exposure may have been, and it helps us to grade what your risk status might be. So if you score at a place where it says, this is something we need to pay attention to, then as a Bahamian resident or citizen, we can't tell you you can't come to the Bahamas, but what we can do is say your risk level is high, and so it's standardized. We're not trying to make this up as we go along. We standardize it and we say, okay, based on that number that comes up in your risk assessment, you should be quarantined. For those people who score lower, then they don't need to quarantine. But we already have your contact information so that just in case something were to happen, someone who traveled with you turned out to be positive. If you show up with symptoms later, then we know exactly what your contact information is, and then we can trace back and also contact trace all the other people who would have come in at the same time.
Makes sense. So you're keeping track. Dr. Brennen, thank you very much for coming. We're out of time for this segment. Continue to do the great job. We really appreciate it.
Thank you, sir. Continue to spread the good news.
Thank you. Well, don't go anywhere. When we come back, we speak with the director of the HIV/AIDS and Infectious Disease Programme within the Ministry of Health, Dr. Nikkiah Forbes, is our guest. Stay with us. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for. Welcome back. You're watching On the Record. This segment is brought to you by private business contractors. Well, it's been making global headlines. We're talking about the uptick in COVID-19. U.S. continues to grapple with another wave of cases, and with our borders set to reopen soon, one could only help but be concerned. My guest for this portion of the show is no stranger to On the Record. She's the director of the HIV/AIDS and Infectious Disease Programme at the Ministry of Health, Dr. Nikkiah Forbes. Welcome back.
Thank you, Mr. Sawyer.
It's been a while since you've been here, and things have changed for us in many ways, but there are still some things that really remain the same and remain a threat to us. I want to begin by talking about the increase in numbers in the United States. That has been very worrying to us. And from a medical perspective, if you could help us to understand how they have gotten to this place again, so it seems, with these high numbers, but even in different states, just next door in Florida, the cases are really through the roof.
Well, as you know, the several states in the United States have been reporting an increase in the number of cases. And as a matter of fact, sadly, there are states that are reporting that their numbers are record-breaking, increasing more one day over the last day. So based on what we know about COVID-19, it's highly infectious. Those people who are coming in close contact with each other, if you're gathering, if you are in crowds and closed spaces, that is what COVID-19 transmission needs. It goes from person to person. And so as we see pictures of crowds and gatherings and mass gatherings, I have no doubt that that's playing a role in the increased number of cases that are being seen.
What did they do wrong? Did they open too soon? Did they not have the right restrictions in place?
I can say that countries that have flattened the curve put in place restrictions very early. They did have mandates for restricted movements. There were even curfews and lockdowns in some scenarios, and populations in some cases were very compliant with those instructions. And so those countries that were able to do that successfully got ahead of their curve or increasing cases very, very early. And so we were able to see in some places cases went down, and in some places, including the Caribbean, they've been very, very good at flattening their curves. There are places that are COVID-free. And so when you ask, what do you do wrong if you don't put in place restrictive measures, if you don't have people following instructions at a very basic level, that is going to be difficult because COVID will spread. It is also difficult to ease restrictive measures when you see cases are going up. It's always good to see successes in cases going down before you allow for increased movement. But each country is different and each scenario is very, very different.
Very good point. The reality of July 1st is we're going to have visitors coming in, but also Bahamians are going to be given the opportunity to travel outside of the Bahamas as well. What advice would you give to individuals who are planning to visit the United States, in particular South or Florida or South Florida?
First of all, when we think about travel, I think it's very pertinent to consider, is travel essential? Mm-hmm. Try to avoid non-essential travel. That would be wise when you're considering going to someplace that could be considered a hotspot or seeing surges in coronavirus cases. If you have to go, then please keep in mind the precautions that can be implemented to reduce getting COVID-19. So, wearing non-medical mask or a cloth mask can help to reduce getting COVID-19. One that's worn properly, it covers the nose and the mouth, trying to avoid crowds, not touching your face, washing your hands frequently, avoid close contact with persons, avoid gathering. That can help to mitigate, reduce the risk of getting COVID-19.
These are the things that we've been doing that we already know.
Yes.
Or should know.
Yes.
Okay, all right. But I like you started out, if you don't have to go, don't go.
Absolutely. Consider the risk and the benefit, and is it essential?
Going to Walmart is not essential. Have there been any new discoveries about COVID-19, things that we are just beginning to find out, or things that are happening that are new to you, that are causing you, that may be attributed to the spike, or anything new that has come about?
So you're right, since the last time I've been here, a lot of time has passed.
Yes.
That was the beginning of the outbreak. So in that time period, we learned that there was a myriad of symptoms that COVID-19 can present with. And it was not just cough, sore throat, or flu-like symptoms. It could be other non-specific things. It could be abdominal pain, nausea and vomiting. It could be loss of taste or smell. We also learned that children could be affected by COVID-19. In the beginning of the outbreak, we thought that children generally fared better than adults when they did get COVID-19 acutely. And that could be true, but then we found out that there could be an inflammatory syndrome that could happen after children were exposed to COVID-19 that could be really quite very serious. So those were some of the things that we discovered about COVID-19. And then there have been breakthroughs in treatment from since I last was invited to your show. So the drug remdesivir, we found out could shorten the duration that someone has COVID-19, and we recently heard last week that there's a steroid medication called dexamethasone that can be very helpful in those people who are sickest with COVID-19, either needing oxygen or on a ventilator, that can help their outcomes. And so we are learning more things about COVID-19, and no doubt that we'll learn more as we go along.
Are we any closer to finding a vaccine?
There is a lot of work being done in vaccinology as it relates to COVID-19. It's been accelerated, and scientists are hoping that by the end of the year or early 2021 that we will have a vaccine against this virus.
With the opening of the borders, that's going to coincide for us with a lot of things too. Restaurants are now being allowed to open. In the beginning, we just saw outside dining, but now inside dining is coming into play. Public transportation is coming back on stream with the rules of social distancing. Students are going to be allowed to sit national exams. How do we protect ourselves even in these environments, despite the fact that we still have the low numbers? You just don't know which the reality is. How do we continue to protect ourselves as we continue to move through these stages and now have more contact with people?
I'm glad you asked that question. That's very important. So when we think about, one, the number of cases of COVID-19 in countries, or in our country, that's a moment in time. So we were able to flatten the curve. Our last case was 2 Sundays ago, and that's good. But this is dynamic. This can change. As we look at things like borders reopening, we know that the only thing that can be done is mitigation steps. There's no 100% solution for detecting travelers, Bahamians, visitors who are coming in. Even with testing on arrival, some of them will have COVID-19. That being said, there will be COVID that will be introduced in country. We must continue, and it's very, very important going forward that we continue all of those preventative measures that we talked about. That gets very, very important. So we know what those are. They've been talked about ad nauseum over the last 3 months. Avoiding close contact, avoiding crowds, closed spaces, wear a mask, don't touch your face. Everybody knows what they are, but we can't get tired of doing that. And really importantly, we have to really continue to do that well going forward. And I would add caution that there are many countries, some of our Caribbean neighbors, our CARICOM brothers and sisters, they had low cases. There's at least one country in CARICOM that had 10 cases for a long time. And in a matter of weeks, they now have over 300 cases. And so if we relax our measures, if we do not take it seriously, then COVID can be spread from person to person. They say, we may forget COVID, COVID doesn't forget us. It's not a smart virus, but all you need is close contact for it to be transmitted. And so I am reminding everyone, all of us, that we have to continue to keep distance 6 feet away from people, cover our nose and mouth when we're in public, try to avoid crowds. That gets very important. If we can do that correctly, we will not see a surge of cases in the second wave. And a lot of that power lies in our hands and our decisions that we make and what we do.
So it's individual decisions that we have to make. I mean, I see people moving around without masks. As I said to you, a few times I jumped out of my car to do stuff and I thought, oh, my mask. 2 months ago, it never left me. And I see all kinds of people, I see people interacting, I see all kinds of things happening. And in my mind, I'm going, I don't know if this is still a safe activity. Have we really put our guards down?
It appears so. when you see pictures, news reports, weekend gatherings, people are taking risks. Maybe people don't think that they are susceptible, but the fact of the matter remains, Bahamians are susceptible to COVID-19. Most of us have not gotten it, and we can spread it to other persons who may not do well, and some people will die of COVID-19. If you require oxygen, if you get very, very sick, there is a chance, if you have other medical problems, there's a chance that vulnerable people will die of COVID-19.
We do know that with the opening of the borders, the virus is going, by all accounts, is going to be reintroduced. Can we return to a lockdown if we don't handle this reopening properly?
So public health experts will tell you if you are seeing surges in cases, then there has to be measures that are put in place to reduce transmission. Some of those measures would be asking people to follow instructions, but when that doesn't work, then there are other measures that are considered, like lockdowns and curfews. So yes, that's possible.
Pretty bluntly, if you don't follow the rules, we may be scaling back on some of these phases. Eh?
Well, it's only good public health medicine that if you're having an outbreak and it's out of control, that you have to put in place preventative measures to get the outbreak under control.
Dr. Forbes, we're going to take a break. We've got a final segment. A lot more questions to go. Some of them were submitted by our online followers, our Facebook followers, who've got lots of questions, particularly one from a family island that I found interesting. Stay with us, though. We'll be back with more on the record right after this.
Matt, where in the world is Matt Lauer? Where in the world is Ellison Greenslade? And so it's about the low value of cottage in Atlanta. So we can talk about it.
More on the record tonight. The government's purchase of the Grand Bouquin is a hot subject in the news. This is On the Record. I'm your host, Jerome Sawyer. Thank you for staying with us for our final segment, which is brought to you tonight by Grand Bahama Power. While it is true that we are not out of the woods yet, one thing is certain: the show must go on. My guest tonight is none other than Dr. Nikkiah Forbes. She's the director of the HIV/AIDS and Infectious Disease Programme at the Ministry of Health. Dr. Forbes, I was in Abaco just recently shooting for another upcoming episode, and I raised a question about how COVID-19 was affecting business on the island with a particular resident. I want you to listen in to Vernon Malone. He's a businessman and resident of Hopetown, Abaco.
I am very concerned because there are a lot of people in Hopetown who refuse to wear masks. The health department should come here and insist that they do that. Every day I have to ask people to leave my store because you're not supposed to be in there without a mask. It's quite a concern with Florida opening up and people not wearing masks, and I've been given every excuse in the world for not wearing a mask. One of them told me, said they considered it the mark of the beast, which is that biblical thing. And I thought, well, you're supposed to abide by the law of the land anyway. I left it in my truck. I have it in my pocket. I left it at home. It's at my job, you know. Well, that doesn't make a difference when you go into a building. You're supposed to wear a mask when you go into a building, especially a food store.
We hear that coming from a businessman on a small key, like Elbow Key, Hopetown. When you hear that, what does that tell you, particularly on family islands which are still as vulnerable as New Providence?
Well, people should wear masks. First of all, they can help to protect you from getting COVID. For those people who have COVID, it can prevent the spread. and they should be encouraged. And there are even some places where they are mandated. Absolutely, I encourage business owners to put signage that masks are needed to enter the establishment. I support it.
Do we need to reinforce, or do you think we need to reinforce the message a little more to people? Because I think we think we're okay and we don't need those restrictions anymore.
Yes, we need to reinforce and remind people that it doesn't mean that we're not vulnerable, and as we relax travel restrictions, yes.
I want to just sort of throw a few questions from some of our online users. This particular user wants to know, how does a test taken 10 days in advance of travel actually make us any safer?
It makes us somewhat safer. So I think Dr. Brennen touched on this, and I'll also reiterate. As it relates to travel, Bahamian residents and citizens returning home from abroad or visitors returning, there is no magic bullet to ensure that all of the returning persons, visiting persons, do not have COVID. There's no way to do it. There's no 100% sensitive test that can say every last person that travels in that's tested does not have COVID. So what can you do then? The only thing you can do is try to mitigate or minimize the risk. So how can you do that? There are ways. There are screening tools. So travelers would need to upload their risk, where they've traveled from, if they're having symptoms. Testing is also another way to minimize the risk. When do you do testing? You have to do it within a reasonable period of time before travel. Some countries do it on arrival, but that also is not perfect. It doesn't mean that somebody doesn't have COVID. Let's talk about COVID testing for a moment. Even in the best circumstances with the PCR, the gold standard test, people who actively have COVID infection, only 2 out of 3 of those persons may be detected, or let me say it this way, 66% of the time, it may detect that the person has COVID. There could be a false negative 1/3 of the time. So it's not a guarantee, you see. Even if you do a test at that moment, it doesn't guarantee that a person doesn't have COVID and is asymptomatic. And certainly when we think about that incubation period, the time when you could be, you could have COVID, but your test is not yet positive, that could be anywhere between 2 to 7 to 14 days in advance. So if I test you today, the test is only as good as that day. So I test you, you're arriving from Miami. I said, okay, Mr. Sawyer, let's test you. It doesn't mean that your test won't become positive the next day or the next day. And so what you see is that there are other mitigation steps taken in combination. There's screening at the airport. There's temperature testing. There could be apps that are placed on people's phones so that we know where persons are. For people who can't do testing, there's quarantine for a 14-day period. And so we know that you should likely run the course of shedding COVID during that time period, and at the end of the 14-day period, it's very unlikely that people will still have sheddable virus. So we're looking at levels to reduce the risk. That's all that anybody could do.
So I want to ask this: if I, you would have already said to us if it's non-essential travel, you really should not do it. If I come back home, should I quarantine myself for 14 days, even if the ministry doesn't give me or doesn't say to me that you need to be quarantined? Should that be a precaution I should take?
Well, that's a very good question. There are some guidelines for some companies that are asking that if you have to travel for work, if you're traveling, that you could quarantine yourself for 14 days. I would say that it's an added precaution. If you have a COVID-19 test result that's negative, that should imply that your risk of having COVID is less. And so we have to think about how we do those things in combination. Perhaps it is fair to say if you don't have the test, you can quarantine for 14 days, but maybe not needed if your test is negative.
How long after the borders open, this is an online question, how long after borders reopen are health officials expecting to see a spike?
Well, if we know the long end of the incubation period is 14 days, then we should know that after persons come into the country, about 2 weeks thereafter, you can expect or project that you might start to see cases if there will be cases introduced. But remember, travel is dynamic. People are coming and going every day when borders are open. And so anywhere between 14 days or 28 days, 2 incubation periods, you can project that if there are travelers returning and they have COVID, and if there's local transmission, then you will start to see cases.
Again, this is another part of that question. They say with an expected spike, but I'll just say with an expected reintroduction of the virus. Should we really have disbanded a few of the COVID resources we had put in place, like the quarantine facility and the COVID hotline?
There is still a number where persons could call in and get information at the Ministry of Health. We can pass that number on to you. And when you're speaking about the quarantine facility, you are speaking about a large quarantine facility where we were able to house repatriated Bahamians. They were mandated to quarantine when they arrived for 14 days. And now that most of that exercise is over, that larger quarantine facility was deactivated, but there are still options for quarantine for smaller numbers of persons. And there's the home quarantine option if your home is appropriate.
Just as a protocol, question, if someone arrives, let's say it's a visitor, and they develop symptoms during that period that they are here, what happens then? What's the protocol at that point?
So what would happen is that they would need to access the healthcare system. So usually we have been finding, and in our experience in the past 3 months, they will either, their hotel may call ahead to get instructions, whereupon if the patient is stable, the person is stable, we can go out to them through the Ministry of Health and get information and enable testing. Or if the person needs medical attention, they will go to one of our local sites, either one of the hospitals. We also have the South Beach Clinic where they can be seen and assessed and get the support that they need. And so that would happen for them, just like it happens for any Bahamian who's developing symptoms.
And those facilities will remain in place. The Blake Road facility, the South Beach facility, those facilities will remain operational.
Yes.
Okay, good to know. Another question from one of our online users. The EU is considering banning U.S. travelers. Meanwhile, we have lifted our ban on countries like China, all of Europe, the Republic of Korea, and Iran. Yet we are welcoming folks from the U.S. and Brazil, even who have overwhelmingly high numbers. What does this say to what we are getting ourselves into?
So we have to keep in mind that there are levels of screening. Before a traveler can come to the Bahamas, they need to upload their information, their COVID test. It's screened, that information is looked at to determine what is that traveler's level of risk, and it can be reviewed for entry. And so definitely there are protocols in place to look at high-risk travelers. It is not just travel with no kind of screening or precautions or protocols in place.
We are in the midst of our hurricane season. There's always the possibility of a storm showing up, as you know, we are all hoping and praying it doesn't happen. But has there been any consideration given as to what will happen or could happen should we be faced with a hurricane as well as this pandemic at the same time? And hurricanes, of course, bring their own risks in terms of diseases, infectious diseases, etc., particularly in the aftermath. But has there been any consideration given as to how we're going to continue to handle this should we be faced with some sort of hurricane or something of that nature?
Yes. In the COVID Emergency Operations Center, we discussed the possibility of getting a storm within the hurricane season and how we would make ourselves ready should that happen. What we would do for our hospitals, for example, where I also provide service, and how we would handle providing care in the hospitals. We would then be in-house for persons who are to present, and there is a plan that was put forward for how we would ensure social distancing in other places, including shelters, and how we would approach the impending storm season.
Mm-hmm. Thankfully, we've only had 11 deaths, and that's not in any way to diminish the seriousness of what would have occurred, and you know that doesn't take away in any way from the loss of life, but there was the potential for so much more. But we saw those deaths very early on, and then there were no more. If we can go back to that point sort of and begin to understand what would have happened, there was sort of, numbers just shot up rapidly, and then there was a tapering off, particularly of the deaths. What would you attribute to that, and how were we able to, was it just coincidence, or what can you say would have led to a slowing down of the death rate?
That was when we were seeing the most number of patients per day. Those were the ones that were presenting to the healthcare system with symptoms. And so if we look at those numbers in that time period, we also know that there are persons that are asymptomatic with COVID-19 or people with very mild symptoms in the community. So one can extrapolate that we had maybe the highest number of cases at that time. So that being said, when we think about the description of how this virus acts, it's called epidemiology. We know that most people, 80% of people, 4 out of 5 people will be fine, but 1 out of 5 people will not be fine and have bad outcomes. And so those deaths were likely a reflection of just how many people had COVID and how many people had severe disease. Remember that we had already put in place restricted measures and that we took this very seriously and were able to flatten the curve. And so by nature, the fact that there are far fewer cases, that should mean that there are far fewer severe cases, and so mortality should be less. So scientists also talk about what is the real mortality rate from COVID. It's probably between 1% and 3%. But if you look at all the numbers in countries, in some countries it went up as high as 15% or more, that should give you an idea of how many cases you would have had in country. And so that is why you will see that as cases go down, so then mortality should go down. But there are also things that may have impacted that in terms of medical support. So just yesterday, there was a statement that was made by a global expert that oxygen therapy can be very helpful in people who have COVID-19 if they need oxygen. And so if people come to the hospital early, if we have heightened awareness that, hey, I have symptoms, I'm having a little difficulty breathing, maybe I should go to the hospital early and check out to see if I have COVID, we can start people on oxygen. Then we also know that there were things like blood clots that were associated with COVID-19. Could we give people anticoagulation? And so maybe just medical support helps those persons to do better. But it's probably a combination of those two factors.
And a good place to end. Dr. Forbes, as always, thank you very much for coming and providing this great information. We just wanted the point of this show at the end of the day to be that we are not out of the woods. Do not let your guards down. It's okay that we are opening up and some things are happening, but remain vigilant. So
absolutely.
Thank you so very much for coming on. That's going to do it for tonight's episode of On the Record, Not Out of the Woods. A very special thank you to my guests, Dr. Delon Brennen and Dr. Nikkiah Forbes. Special thanks as well to my production and technical teams, and of course to you, our viewers. As always, we appreciate your continued support. Look forward to having you back again. Same place, same time. Until then, I'm Jerome Sawyer. We'll see you next time right here.